Hello, I'm Dianne Robbins. I'm a physical therapist at Virginia Sports Medicine, and today I'll be demonstrating stage 1 of our tennis elbow and golfer's elbow exercise program. Basically, it's comprised of 5 exercises that you will progress as tolerated per the condition. Each exercise can be progressed individually depending on your tolerance. So the first exercise in stage 1 is wrist extension. You want to start with your elbow bent at approximately 90 degrees, resting on either your thigh or on the edge of a chair, whatever is most comfortable for you. And you will slowly, to a count of 2, raise your hand up in this position, and then slowly lower it back down. You want to see a little bit better? 1, 2. Down, 1, 2. And you would perform this exercise 1 set of 10. If comfortable, you can continue on and do a second set of 10. That's the first exercise. The second exercise, you turn your wrist facing the ceiling and you bring your hand all the way up and down. Again, the elbow remains at 90 degrees and resting comfortably on either the forearm of the chair or your thigh. The third exercise, you would take the weight, or if you're holding, you can start a light weight. You can hold like a soda bottle, you can hold the end of the bottle or the end of the weight, and you start with your palm up, and you very slowly turn your palm down in this position. Another option, instead of using a weight or a soda bottle, you can use a hammer. The closer you hold to the hammer head, the less resistance. As you progress, as you would be increasing the weight, you move down. The further down the handle, the more difficult the exercise. Again, all the exercises should be performed nice and slow and with minimal or no discomfort. Those are the 3 basic weighted exercises. Then in addition to those exercises, you just use a regular rubber band. You can use multiple rubber bands to increase the resistance. You put the rubber band around your fingertips and you just extend your fingers and your thumb. You can do these 10 to 20 times. The last exercise is just squeezing a ball. You find a soft ball, one of the stress balls that they have out there. You can squeeze a rag, a sponge, depending on how much discomfort you have. The harder the ball, gives more resistance, but you do want to see compression. You do want to squeeze down. You don't want to just be working the fingertips. Now, as you can see, while I've been performing the exercises, I've been wearing this lateral elbow brace. They can help to minimize the discomfort you have while you're performing the exercises. They may be recommended to be used while you do the exercises by your physician or your physical therapist. You would follow their advice. What it does is it transfers the stress from the tendon up here where you have the discomfort in your elbow down into the muscle belly. So it allows you to perform the exercises more comfortably with minimal irritation. What we'll be demonstrating today are the tennis elbow exercises and or golfing elbow exercises, stage 1. When you start the exercises in an acute stage, you want to start without any resistance, no weight. You would perform the exercises once a day and only once a day. They should not create increased symptoms. That means you should not have increased pain. If you have pain all the time and you have some discomfort while you're doing the exercises, that's fine, but you do not want to increase your symptoms. If you have increased symptoms as a result of doing the exercises that last for more than about 2 hours, that also is not recommended, and a sign that you're doing too much and you need to go back a little bit with your repetitions or your weights. So the exercises will be performed, as I said, once a day. You start with no weight and you do about 10 repetitions. And then you gradually increase that to 2 sets of 10. From there you would go 1 pound, 2 pounds, 3 pounds, gradually progressing as tolerated. One exercise may be progressed faster than another, and you might be using weights with one exercise and no weights with another, depending on where your pain's located and which particular exercise irritates those areas. When you're done doing your exercises, you would like to apply ice to your elbow for about 10-15 minutes. And again, you only want to do the exercises once a day. They should not be increasing your pain, as I said previously. This is not a condition where you work through pain. When you are able to complete stage 1 exercises with 3 pounds of weight, then you will now progress to stage 2.